High blood pressure is often called a silent condition because of the damage it causes quietly. To understand how this happens, let me share a short story. This is Aisha. She is 52, a mother of three, living a full and busy life. Like most people, she balances work, family, and daily responsibilities. For years, her doctor told her her blood pressure was high. She was given medication, but because she felt fine, she stopped taking it. She had no pain, no warning signs. She felt healthy. And then one morning, while making breakfast, a spoon slipped from her hand. Within minutes, everything returned to normal. At the hospital, doctors explained that Aisha had experienced a transient ischemic attack, often called a mini stroke. It was caused by a temporary interruption of blood flow to her brain. Years of uncontrolled high blood pressure had quietly damaged her blood vessels. High blood pressure doesn't always cause symptoms, but the damage can still be real. After her hospital visit, Aisha was surprised. She had felt healthy, no daily pain, no warning signs that something was wrong. Yet her doctors informed her that years of uncontrolled high blood pressure had damaged her body. This damage did not happen overnight. It happened day after day while she was busy living her life. Hello, this is Dr. Ebua Erebor, and welcome to Faith Aligned Medicine, a space for clear, evidence-based conversations about health, prevention, and caring for your body wisely. Now, today we are continuing our conversation about high blood pressure and why understanding it can help you protect your future. Now, high blood pressure can quietly damage your brain, your kidney, eyes, and even your heart. The blood vessels are meant to stretch and relax, but under constant pressure, they become stiff, narrow, and less flexible. And this reduces the blood flow to our vital organs, which were the organs I just mentioned previously. For example, in the heart has to work harder to push blood through these very tight vessels. And over time, the heart muscle begins to enlarge and gets thicker, and it becomes less efficient. And this increases the risk for heart disease, heart failure, or even a heart attack. And sometimes these things happen even without any symptoms. A similar mechanism also happens in the brain, where the damaged blood vessels can increase the risk for a stroke or a mini stroke, like we see in the case of Aisha, who suffered a mini stroke unannounced. The reduced blood supply through the vessels in the brain can also affect memory and thinking over time. And most times, these changes are so subtle and easy to miss. The kidneys and eyes are not left out. The kidneys often rely on a healthy blood supply to filter waste out of our bodies. In cases where there's uncontrolled high blood pressure, this affects the tiny vessels inside the kidney, therefore compromising kidney function and leading to kidney disease. The eyes are also impacted in a similar way, and vision is affected. Sometimes this could be permanent. The most dangerous part is that this damage rarely causes pain. People often feel well until serious complications occur. And this is why high blood pressure is so often discovered after the damage has already occurred. Well, the good news is that this damage is not inevitable. High blood pressure can be detected early, it can be monitored regularly, and it can be managed effectively. Small, consistent steps like checking your blood pressure, following your treatment plan, and making healthy lifestyle choices can help to protect your heart, your brain, and your organs for years to come. In the next episode, we'll talk about why many people do not realize they have high blood pressure and simple steps you can take to stay healthy. I hope I see you there. If this has helped you learn more about your health, please consider subscribing and sharing it with someone you care about. Remember, caring for your body isn't a lack of faith, it's stewardship. I'm Dr. Ebua Erebor, and this is Faith Aligned Medicine. Thank you for watching.